In an update tonight, the family of an Oregon man who died in custody at the state hospital last year is now suing the state, claiming severe neglect and abuse. Catherine Cook talked with attorneys about the case. And Catherine, we should note some of these details here are truly tough to hear.
Yes, David, they say many concerns in this case point to a systemic problem at the hospital. In this case, they believe staff could have prevented Kenneth Hass's death, but instead, they say it appeared they expected it.
Sienna Hass lost her brother and her best friend in an inhumane way.
Justice, accountability, and prevention. That's what attorneys say Sierra Hass is seeking on behalf of her brother, Kenneth Hass. Hass died in March of last year while in custody at the Oregon State Hospital in Salem. He was 25. His family says he'd been there for 3 years to receive psychiatric care.
And they expected and hoped that he was going to get better, or that at least that the state hospital would try.
Attorneys say Hass spent his final 250 days in seclusion, locked in a room, often covered in his own feces. They also say he spent over 500 hours tied to a bed, leading to sepsis and infections.
It's egregious. It's as bad as any kind of care you could get. His own psychiatrist described him as having a terminal psychotic illness, which isn't even a medical term. So they just expected him to die, and he did.
The lawsuit claims hospital staff knew Hass had a compulsion for drinking from the toilet, yet left his bathroom door unlocked. On the day he died, the suit says Hass drank nearly 90 cups of water, fell, and began convulsing, ultimately dying of water intoxication.
And they sat and watched him on the video for over 4 minutes as he was choking, seizing, and vomiting. And then he was pronounced dead an hour later.
The lawsuit points to the hospital's history, noting the Oregon Health Authority reported 21 patient deaths in the past 5 years, 9 of them unexpected, with multiple involving patients who'd been placed in seclusion. State health officials tell KGW they don't comment on active litigation.
It's not just Ken. This has been going on a long time. It's institutionalized. The hospital has been the subject of outside scrutiny for decades. They've been the subject to audits, and they don't make any changes. They don't do anything right. They don't fix what's broken.
In a statement, Hass's sister said Kenneth deserved respect and dignity, and the hospital failed to acknowledge this and caused him to suffer for so many years. Kenneth would be honored to know that his death can serve to change how those still living at the hospital are treated. The lawsuit seeks at least $375,000 in damages and also a systemic overhaul. Attorneys are asking a federal judge to appoint a special master to supervise and implement changes at the hospital. David.
A lot at stake there. Catherine Cook reporting. Thanks, Catherine.